I'm here with Scott Johnson, the Vice President of the Seckman Reid Technology Group, and welcome.
Thank you. It's great to be
Thank you for
here.
having this event.
Absolutely.
Can you tell us a little bit about what your group is doing to bridge the gap to hospitals that are facing the future of technology needs?
Sure. So our group's main purpose is to help owners walk through the process of planning, budgeting, and then designing technology systems as part of healthcare construction projects. So in that process, as we manage their priorities for investment in different technologies, I think our best, in answering that question, our best approach is to see into the future in terms of where technology trends are headed, especially where it gives the best outcomes for clinical quality and for staff efficiency. And just as we heard today, facilities really need to be focused on how a patient connects with their caregiver, and increasingly that interaction is through technology. And so we bridge the gap, A, to provide the infrastructure to enable those transactions, but B, to look at the technologies that are coming down the road and capture those as part of a construction planning effort so that the industry can make best use of those solutions.
So this is a different care model in the past of the business of designing and building a hospital. It's never really been the intent in the past to intentionally connect the patient with their provider. It was mostly doing infrastructure. How is that changing today?
Right. So we are seeing an increased emphasis on interactive systems for patients and families, beginning at the home, from a registration perspective, and then into the hospital, in the patient room, with systems that enable the patient to see and understand and be introduced to their care team and their care process, and in the patient room have access to all of that information so that the patient feels connected, again, through the use of technology, to be informed and connected to the providers that they're receiving care from.
So you manage a practice that entails the entire United States and now overseas. How do you keep that focus on that, conscious with the payment being so disparate?
I mean the provider?
The provider, yes.
The provider payment being so, all right, well, I'm going to go back to another theme that came out of today's discussion. That is, we have to know our clients. We have to know the circumstance in which they're providing care. We have to know the demographic of the patient community and understand what is the best investment to meet that particular circumstance. And I'll tell you, it just has to be a new tailored thought process for every client, every engagement, depending on the location and the circumstance, whether it's academic teaching hospitals like Johns Hopkins, or whether it's a small community hospital, which may be very limited on funds, and their way of interacting with patients and connecting with the patient community is going to be different. And we have to understand if they're connected with a larger health system, even in a rural setting, to know if we have the ability to take advantage of some other initiatives that may be enabled by an affiliation with another hospital.
What are the biggest pain points you're hearing from health systems as far as planning the infrastructure and technology for the future?
The biggest pain points probably are still that in our current economic circumstance as a country and as healthcare systems and the healthcare system in general, budgets are limited. And so it is a difficult process to prioritize what technologies are going to be the most benefit for the money long term. I think we solve that through installing a flexible infrastructure to be able to adopt new technologies in the future. But again, prioritizing technologies on the front end is probably the most difficult thing. And planning and designing it is a simple thing to follow through in general. But,
So what makes SSR Technology Group the best?
Well, I like to think it's because we have a unique blend of expertise that we bring from the industry. For instance, myself, I'm an electrical engineer with a history in building construction. We have IT professionals who know what it takes to be successful in deploying an IT environment. We have people who are clinicians that understand clinical workflow and what it means for technology to be able to enable or steer away from those technologies that hinder the delivery of care so that we steer our clients in the right direction. It's not just about putting in back boxes and conduit and the right infrastructure to support these technologies. It's about knowing which technologies and how they are deployed best benefit our clients.
Well, thank you for putting on this summit.
Thank you.
All
It's
right.
been a pleasure.